The Sonosite Edge offers superb image quality and increased speed, along with Sonosite's traditional reliability in a laptop-sized unit. This short video will demonstrate the key features and functions of the Sonosite Edge system. For more in-depth information, please refer to the System User Guide. The Edge operates efficiently on either AC or battery power. You install the battery with the system upside down. Slide the battery into the battery compartment, then slide the two locking levers out to secure the battery. If the battery is being installed for the first time, it will need to be charged. To remove the battery, slide the two locking levers in. Slide the battery up, lifting the battery from the compartment. To turn the system on, press the power key once. The system will power up completely in 15 seconds. Press again to turn it off. To connect a transducer, turn the system upside down. Pull the transducer latch up and rotate it clockwise. Insert the transducer connector, turn the latch counterclockwise, and press the latch down. To remove the transducer, pull the latch up and rotate it clockwise. Pull the transducer connector away from the system. On the right side of the system, there are ports for USB devices. These can be used for image storage and system software upgrades. The system control panel is simple to use. Many controls and features are automated to simplify the user interface and minimize the number of keys. And the keys are backlit for easy viewing in darker environments. To turn the system on, press the power key once. The alphanumeric keys are used to enter text and numbers. Text turns the keyboard on and off for text entry. Picto turns the pictographs marker on and off. Arrow displays an arrow that can be moved and rotated within the image area. Zoom magnifies the image 2 times. Press once to choose region of interest and again to magnify the area of interest. The system can automatically adjust the 2D gain levels to the optimal level. Select Auto Gain to activate this feature instead of using the manual gain controls. There are 2 keys for adjustment of imaging depth. Depth up decreases imaging depth. Depth down increases imaging depth. On the left-hand side, there are 3 controls for gain compensation. Near adjusts the gain applied to the near field of the image. Far adjusts the gain applied to the far field of the image. And gain adjusts the overall gain applied to the entire image. When an image is frozen, the gain key can be used to review images in the Cine buffer. Increasing or decreasing the gain buttons scrolls backward and forward through the stored images. In the lower middle of the control panel is the touchpad, which can be used to select, adjust, and move objects on the screen. Surrounding the touchpad are the system controls that are used most frequently. The freeze button stops the live imaging and displays a frozen image. The select key is used to make various choices depending upon the function that is activated. It is used to switch between calipers for measurement, selections on color and Doppler menus, frozen images in duplex and dual screens, pictograph marker position, and arrow position or orientation. There are 2 functions on either side of the trackpad, Set and Save Calc. The Set key confirms caliper location for measurements. The Save Calc key transfers the measurement to the patient report. The Calcs key turns the calculation menu on and off. The menu displayed is determined by the transducer selection and exam type that is chosen. The generic caliper button activates up to 8 sets of calipers on the screen. From this menu, area measurements may also be selected. On the right side of the touchpad, you have image storage options. Clip storage allows you to save a movie of the ultrasound image. A clip length from 2 to 60 seconds may be captured. The Save button allows you to save an image or clip to the internal storage on the system. The exam key is located above the touchpad. This key can be selected during a patient exam to quickly change exam types without having to return to the patient data entry screen. The Exam Types menu lists the exam types that are appropriate for the transducer selected. Selecting the appropriate exam type ensures that system parameters have been adjusted for optimal viewing of the structure of interest. Off to the right side of the touchpad are 2 shortcut or programmable keys, A and B. You may choose a function for each of these keys in the Setup menu. You may assign functions to these keys to create the shortcut you desire. Other functions include Show or Hide Mode Data, End Exam, Reset Gain Setting to Defaults, Clips menu, Print, MBE, and None. Above the A and B keys is the Update key. This allows you to toggle between dual and duplex screens and image modes in M mode and Doppler. At the top of the control panel are a series of 6 sets of 2 button groups. These are the remappable controls, or soft keys. The keys are used to adjust the values of each control displayed in the context menu. The menu displayed will vary depending on the mode or feature activated. When selected, the key will cycle through a list of values, or the up-down function can be used to quickly access the function. The mode buttons are located on the lower right-hand side of the control panel. M mode turns M mode on and toggles between M mode sample line and M mode trace. Doppler turns Doppler on and toggles between Doppler sample line and Doppler trace. Color turns Color Doppler or Color Power Doppler on and off. You may use the 2D button to exit any scanning mode and return to 2D imaging. This short video will outline the steps to optimize the ultrasound system to perform an examination. To start the study, press the Patient key. Enter the information into the appropriate fields, including patient name, ID number, date of birth, gender, and exam type. When you have completed patient information entry, press Done. The exam type symbol will now indicate the exam type that has been selected. Use a coupling gel to remove any air between the transducer face and the skin surface. The system has advanced image optimization technology that greatly simplifies user controls. Many of the controls such as tissue harmonic imaging, SonoMB, and Sono HD are automatically activated with exam type. Therefore, only a few controls may need to be adjusted to obtain the best image quality. This tutorial will review the key functions that are used most frequently when optimizing an image. Please refer to the user manual for a complete explanation of all controls that may be adjusted. Once you have located the area of interest, adjust the depth of image to center the area of interest in the middle of the image display. As you adjust the depth, the maximum depth number changes in the lower right corner of the screen. Select the desired optimization setting from the on-screen menu. Res provides the best resolution possible. Gen provides a balance between resolution and penetration. Pen provides the best possible penetration. For quick optimization of the gain settings on the system, press the Auto Gain key. The system will evaluate the image and apply the appropriate gain level settings to the image. If you would prefer to change the gain settings manually, adjust the near, far, or gain keys on the lower left side of the control panel to increase or decrease the amount of gain applied to the near field, far field, or the overall image. You may save the image you have frozen or review individual frames in the Cine buffer. The Cine buffer can be accessed using the touchpad or gain key. Moving across the touchpad or decreasing the gain key reviews images retrospectively, and increasing the gain key reviews images prospectively. The frame number will change dynamically as the touchpad or gain key are manipulated. A measurement may be performed on a frozen image. Activate calipers by pressing the caliper key. Move the caliper to the point of interest by using the touchpad. An active measurement will be displayed in the bottom left corner. To perform a linear measurement, place the caliper at the point of interest and press the Select key. Another caliper will be activated. Move the caliper to the point of interest to complete the measurement. Area measurements may be obtained by using the ellipse or manual trace methods. To label the image, select the Text key on the keyboard. You may select a text label from the annotation lists or type the label on the screen. When you are ready to store your image, select Save to save the image to the internal storage. Approximately 64,000 images may be stored on the internal storage. Press the Freeze key or 2D mode key to return to live imaging. Press the Color key to activate Color Doppler or Color Power Doppler. A region of interest, ROI box, will appear in the center of the screen. Use the touchpad or arrow keys on the control panel to change the position or size of the ROI box. Use the Select key to toggle between changing position or size of the ROI box. The settings for color will be displayed in the top left corner of the screen. Select the desired sensitivity from the on-screen context menu. Low optimizes the system for low flow state. MED optimizes the system for medium flow states. High optimizes the system for high flow states. Use the Gain key to adjust the overall color gain level for Color Power Doppler or Color Doppler. You may freeze a color image to save or review individual frames in the Cine buffer. Just as in 2D imaging, the Cine buffer can be accessed using the touchpad, gain key, or arrow keys. Press the 2D or color key to return to 2D imaging. Color Doppler may be used to quickly identify where blood flow is located in a structure. Pulsed wave Doppler may be used to detect and measure the velocity of blood flow through a vessel. To activate Pulsed wave Doppler, press the Doppler key. A Doppler sample line will appear. Use the touchpad or arrow keys to place the sample line in the blood vessel. Note that the color ROI box is tied to the Doppler sample line. Press the Doppler key again to activate the Doppler spectral trace. Press the Update key to toggle between the Doppler spectral trace and 2D imaging. Select Freeze to stop the Doppler spectral trace when an adequate sample is obtained. To review the trace at different points in time, use the touchpad, arrow keys, or gain key to access the Cine buffer. Measurements may be performed on the Doppler spectral trace by selecting the caliper key or Calc's menu key. If desired, press the Save key to save the image with the measurements displayed. Press the Freeze key to return to the live Doppler spectral trace, or press 2D imaging to exit Pulsed wave Doppler. When you have acquired all images for the study, press the Patient key and choose New/End Exam from the on-screen menu to finalize the exam and end the study. This concludes this brief review of imaging modes and system controls to optimize the ultrasound image. For an extensive review of system features and functions, please refer to the System User Manual. This video will demonstrate how to save images and clips, recall these images for review, archive, or export images to a USB device. Images or clips of the ultrasound study may be obtained and saved to internal storage on the system. To save a frozen image, select the Save button. Images of the screen display or patient reports can be saved to print or export. To save a clip, press the Save Clip key. A clip length of 2 to 60 seconds can be selected. To view a report of all patient data and measurements, select the Report key. This information can be saved with a patient exam by pressing the Save key. Each page of the report can be viewed by pressing the next key in the on-screen menu. Save each page of the report to include with the patient exam information. Press the Review key to view a patient list. The patient list displays all exams stored on the internal storage of the ultrasound system. The list can be displayed alphabetically or by the order of archival: A to Z, Z to A, or most recent or earliest. The header at the top of the screen identifies patient and image information for the study. This includes patient name, ID number, date and time of the exam, the sonographer's initials, image and clip number, and connectivity: completed, suspended, archived. To review a patient exam, use the mouse to select a patient exam from the list. The exam highlighted in blue is active. To select a patient exam to archive, check the box on the left. To choose additional patients, just scroll down and select each exam. Notice each patient exam has a check mark to indicate it is included. Once you have completed the selection, select Export to send all images to the USB device or archival device. Leaving the box blank will remove the patient's identifying information from the images or clips. Up to 3 USB devices may be connected to the system at one time. Select the USB device prior to exporting images. This is a brief overview of image review and archival. For more complete information, please refer to the user manual.